So I'm Dr. Chaitanya. I'm the consultant aesthetic physician working at Dermapod Skin and Hair Clinic.
Dr. Chaitanya, I wanted to know, how did you find us?
So we started Dermapod around a year ago, approximately. So we'll be turning one in July. So since we started, marketing was a very big part of the clinic, and we were constantly in search for a good marketing team. And we did work previously with two, three other agencies. Since we were not very satisfied, so we were always on a search for it. And my partner came across your marketing agency. And after having a discussion, he was satisfied, and we went on board. Since then, it's been good.
Can you just give some more context as to what your clinic does and give a sense of all of the services that you provide?
We are majorly a skin and hair clinic. We are into aesthetics. We do all the cosmetic procedures like, lasers, non-invasive things, and even minimally invasive things like Botox fillers. But we're
Mhm.
mostly into the aesthetic part of it, not dealing with the core dermatology part of it.
Can you give a sense of how your experience has been and how the results have been as well while working with us?
Okay, sure. So yes, like I told you previously, we were associated with other marketing agencies. The major difference, what I and my partner can see, is the quality of the leads. Because even when we were working with other marketing agencies, what used to happen is the quantity was fine, but when we call them up, the patients are either not interested or they don't even respond sometimes. So it's just the number, and the quality used to always, not be that great. So the major difference I would say is the quality of the leads. So most of the patients are interested, and it's upon us to then just talk to them and convert them. But the quality is something that we really appreciate.
Perfect. Has revenue or has the patient footfall increased while working with us? Can you give our audience a sense of if the ads have actually brought patient footfall and how you notice that, how you monitor that?
Yeah, definitely. I can say the footfall has been increased. And, especially for procedures where we are targeting the audience, like laser or any other procedure that we are running the ads for, I think keeping those procedures in mind, definitely the footfall and the revenue has increased.
Awesome. Can you also walk the audience through certain challenges that you face as a clinic and how you actually manage your digital marketing? How do you manage the inquiries and what sort of systems you have in place there?
So the major challenge is definitely, getting more footfall, because skin clinic or aesthetic clinic is not something very rare. There are like 10 clinics in a road in any major city. So yes, I think that is one challenge where you try to connect to the relevant audience and try to bring them to, come for consultation, and then, convert them for the procedures. Because as such, for a skin clinic or an aesthetic clinic, we have a lot of investment, and we are always looking for, return on that investment, because most of our devices are, pretty expensive, and it is a burden if the footfall is not that great. So yes, that is something I would say is a very big challenge for any clinic. So targeting the right audience and getting them to come to the clinic, just establishing the clinic as a brand itself is the challenge.
Right, right. And is there any advice that you'd like to give doctors that are watching this that have their own clinic to be able to be successful in this space, or people who want to start their clinics? I meet a lot of doctors every day that want to start their clinics as well. So is there anything that you'd like to say to them to be a part of this journey?
Okay, so one thing I would like to say is don't compromise on the quality. So there are always patients who will ask for cheaper versions of the particular treatment, but once cut down the charges, you will definitely have to compromise on the quality. But then in the long run, you'll not be able to sustain, because aesthetics and skin is such a field that you have a lot of repeat customers and repeat clients, as in. So when they are not happy, so the word spreads, and in the long run, for the sustainability, it becomes very difficult. So even if you're charging a little more than whatever it is, just don't compromise on the quality.
That makes a lot of sense. I feel like the words that you've given the audience, I think that would be very helpful for doctors as well to have an understanding of how they should run their clinics and how they should. Some of them who want to start their clinics, I feel it will be helpful for them as well. So thanks a lot for your time, Dr. Chaitanya. It's been great talking to you. And I hope we continue to work for years to come and we continue to get amazing results as we move forward.
Sure. Thank you so much.
Thank you.